Months after the birth, the bump hasn't gone. You're eating carefully, you've started walking, and there's still a soft pooch below your belly button that won't shift. And every article you find just tells you to eat less and do more crunches. Here's what almost nobody leads with. For a lot of women, that pooch isn't mainly fat. It's a structural change to the abdominal wall. And if that's what's going on, dieting and crunches won't fix it. And crunches can actually make it worse. Let's weigh it up, gently and honestly. What is diastasis recti? During pregnancy, as the bump grows, the two halves of the abdominal muscles, the six-pack muscles, are pushed apart, stretching the band of connective tissue running down the middle. Cleveland Clinic describes the result as a gap that can leave the belly bulging or pooching after childbirth. It's called diastasis recti. It is extremely common. It is a normal consequence of growing a human being, and it is not something you did wrong. And here's why it matters for this video. No amount of calorie deficit closes a gap in connective tissue, because the problem isn't the fat on top. How to tell the difference? So how do you know what you're dealing with? Broadly, three things can create a post-baby pooch, and they often overlap. There's genuine body fat, gained during pregnancy, which does respond to the usual whole-body approach over time. There's diastasis recti, the abdominal separation, which often shows as a bulge or a visible coning down the midline when you sit up or strain. And there's ordinary bloating and fluid shifts, which come and go through the day. The honest answer to which do I have is not something a video can give you. Cleveland Clinic and pelvic health specialists recommend being assessed. A healthcare provider or a pelvic floor physical therapist can check properly, and that assessment is genuinely worth getting before you commit to any plan. Why crunches are the wrong instinct? This is the part that changes what people do. Clinical guidance is consistent that exercises pushing the abdominal wall outward, crunches, sit-ups, that whole family, are the ones to avoid while a separation is healing because they can worsen it. The intuitive fix is the harmful one, which is also why waist trainers, belly binders as a fix, and flat tummy tees miss the point entirely. None of them address connective tissue, and the tees are the same debunked shelf we covered in our fat burners video. What actually helps? So what does help? Four honest things. First, get assessed. A pelvic floor physical therapist is the specialist here, and they can build a program suited to your body and your birth. Second, gentle deep core and pelvic floor rebuilding, done at the right stage and with proper guidance. That sequencing matters more than intensity. Third, time. University of Utah Health notes recovery varies enormously, ranging from a couple of months to around a year, and many separations improve substantially on their own. Fourth, and only alongside all that, the ordinary whole body basics for the fat component: protein, gentle movement, sleep where you can get it, and patience. And one clear line: how soon you start anything, especially after a cesarean, is a medical question. Guidance commonly involves waiting for clearance at a postnatal check, and often longer after a C-section. But commonly isn't you. Your provider decides that, not us and not an influencer. The bit that needs saying. And something worth saying plainly, because this niche is unkind about it. Your body did something extraordinary, and there is no deadline for how it should look afterwards. Bounce back is a marketing phrase, not a medical one. If low mood, anxiety, or feeling overwhelmed are part of your picture right now, please talk to your doctor or midwife. That matters more than any pooch, and support exists. The bottom line: 4 points. 1. Much of the post-baby pooch is often diastasis recti, abdominal separation, not just fat. 2. Which means calorie deficits and crunches won't fix it, and crunches may worsen it. 3. Get assessed. A pelvic floor physiotherapist is the right specialist, and timing after a C-section is your doctor's call. 4. It commonly improves with proper rehab and time, and there's no deadline you're failing to meet. That's the post-baby belly, weighed up honestly and, we hope, kindly. Thank you for watching. We know your time is scarce right now, and we're genuinely grateful you spent some of it here. If this was useful, follow Weighing It Up and switch on notifications. We post several videos a week on fat loss, diets, and the claims aimed at all of us, and the bell keeps you up to date. And if you're comfortable, share in the comments what your recovery has actually looked like. Honest experiences from real people help others reading far more than any article. We love hearing how you're getting on. Until then, we read the studies, we check the prices, and we weigh it up.